Ever wondered how total knee replacement surgery is performed? It's a common procedure for people with severe knee pain caused by arthritis or injury. The surgery begins under anesthesia so the patient feels no pain. A cut is made in the front of the knee to expose the damaged joint. The worn-out surfaces of the thigh bone and shin bone are carefully removed using precise surgical tools. Then, metal implants are attached to replace those surfaces, and a smooth plastic spacer is placed between them to allow the joint to move freely, just like a natural knee. In some cases, the underside of the kneecap is also resurfaced with a special implant. Once the new artificial joint is in position, the incision is closed with stitches or staples, and a bandage is applied. The surgery usually takes 1 to 2 hours, and patients start walking with support soon after. Over the following weeks, with physical therapy, the new knee becomes stronger, movements become easier, and pain is greatly reduced, giving patients a new chance at active living.